goals of the Infectious Disease Division are to provide the best possible care to our patients and to do research that advances the field and to teach the next generation of infectious disease physicians.
The ID Fellowship actually is the heart and soul of the division. So the way that we look at things is that we all have our own expertise, we all have research that we're interested in, but the true joy that we get out of our jobs is training our ID fellows. The great thing about being a part of the ID Fellowship is that you're not only a part of a family where you will feel nurtured and taken care of, but you're part of a legacy that has been going on for decades of exceptional infectious disease physicians, but also wonderful people.
The unique aspect of this program is the extremely supportive staff and the close-knit family we have here. I'll always remember the multidisciplinary rounds that we have here, which involves all our attending, our ID pharmacists, our residents and students, which is immensely helpful for our learning, as well as our weekly grand rounds, which has great discussions for fellows and attendings.
We have a nationally renowned infectious disease department that was specially designed to take care of patients with extremely contagious diseases.
As you were referring to a number of outbreaks across the United States in that population, they have now been added to who should be vaccinated.
I think since the beginning of the pandemic, the ethical issues associated with many different modalities of treatment and how we decide who gets it has been hotly debated.
But I think it is worthwhile. I think in particular, the sorts of surveillance that you were describing is very valuable on a population level. So it gives us information.
It was decided very quickly that the fellowship training experience would be greatly enhanced by merging the program at Rush to the existing program at Cook County Hospital to enhance the exposure to diverse socio-demographic populations, as well as engage intently in the social determinants of health. In the creation of this joint Rush Cook County Health Infectious Diseases Fellowship Training Program, we've been able to expand our footprint in addressing evolving environments that impact success in our ability to control both entrenched and emerging pathogens. This includes settings such as refugee health and correctional care, not to mention a recent succession of pandemics and epidemics, most notably COVID-19 in 2020 and Mpox in 2022, which demanded the full forces of infectious diseases expertise, including effective communications to the general public as leaders in this public health space. As we've now been selected as one of 11 programs in the U.S. to launch the new combined ID and EIS fellowship, we look forward to advancing our shared resources with a deep bench of former EIS officers within our division to further the careers of those interested in a dual path of infectious diseases together with public health investigations and surveillance.
After fellowship graduation, fellows have gone on to different roles, including infectious disease consultants in both inpatient and outpatient settings, in academic as well as private settings. Some fellows have also established careers in research, transplant fellowship, as well as other specific areas of infectious disease.
Our ID department is like a family. We do really take care of each other. That's the thing that I really liked about our department. When I decided to apply for the LEAP Fellowship Award, my ID division, the entire ID division, gave me the full support from A to Z.
One of the most special things about the program is the sort of open door policy. All of the attendings keep their office doors open. You can go in and discuss cases with any of them at any time. They are very helpful and they are great mentors. So they're really interested in having a relationship with the trainees and making sure that they are training their peers and that we are developing the skills that we need to be successful and become independent after our training. The success that I'm most proud of in my training is obtaining an R21 NIH grant, which has supported my research in looking at antiretroviral therapies and how they affect glial cells in the human brain. And I'm very grateful to my mentors, Dr. El-Harthi, Dr. Shah, and Dr. Aziz for their support and being able to accomplish that.
I trained at Rush. I was a medical student at Rush and resident and fellow. And during residency, I started seeing patients at Core Center, and that was the attraction for me to go into infectious disease and also working at Core Center, because it's this very special, unique place where we manage about 6,000 HIV patient population in the same center. It's one of the biggest centers in the country that manages HIV. And the fellows get to do their primary care clinic at Core Center.
Infectious diseases is the most interesting and fun of the medical specialties. We get to be medical detectives. We get to care for these very complex patients who need somebody to very carefully delve into their medical history, all of their laboratory results, their physical exam, and make a diagnosis to get them better.
I think that there's something very unique about our division in that we have a career development program with pathways for fellows interested in research careers that incorporates options to do a master's in clinical research and an optional fully funded third year of research. We also have clinical pathways with options in HIV, transplant ID, global health, and a novel community ID private practice pathway.
You know, you all have decided you might want to go into infectious diseases. Brilliant move. And you're looking at the Rush County Fellowship, even smarter. We're a great place to come. We have excellent clinical care, excellent research, federally funded research for decades, and we have a great time doing the work we do. So if you're interested in infectious diseases and you want a great clinical program and a great academic program, you're looking at the right video. And if you want to enjoy life while you're doing it, Chicago couldn't be a better place.